Dementia by Amber Monroe. What is dementia? Dementia is not a disease. Dementia is a group of symptoms that affects mental tasks. Dementia is a syndrome caused by brain cell death. Dementia is more likely to progress with age, and there are an estimated 47.5 million dementia sufferers worldwide. There are many different types of dementia. These types include Alzheimer's disease, vascular dementia, Lewy bodies disease, Parkinson's disease, frontotemporal dementia, Creutzfeldt-Jacobs disease, Huntington's disease, and mixed dementia. Diseases like Parkinson's, Alzheimer's, Huntington's, and HIV lead to the progressive brain cell death that can cause dementia. The damage to the nerve cells in the brain that can occur during stroke, head injury, or brain tumors also can lead to dementia. Diagnosing dementia. There is no one test to determine if someone has dementia. Doctors can diagnose types of dementia based on a patient's medical history, physical examination, lab tests, and the changes in behavior and the patient's day-to-day function. There are 7 stages of dementia. Stage 1 is where a person still appears normal and they can cover up their lapses in their memory. Stage 2 is when they start to forget certain things but can normally function otherwise. Stage 3, a person starts having difficulties at work, becoming anxious, and the family starts to become more aware. Stage 4 is where a person starts to lose the ability to count. They find travel very difficult because of the change that happens during travel, and they can no longer manage their own affairs. In stage 5, the person needs help getting dressed. Stage 6 is where they start to need help eating, they need help using the toilet, they may become incontinent, they're disoriented from time and place, and they possibly start to forget who they are as a person. Stage 7 is when they have severe speech loss, motor stiffness, incontinence, they need feeding, and they have total disorientation. This stage is the final and end stage, and usually afterwards, death occurs. There are signs of dementia versus signs of aging. Signs of dementia would include poor judgment and decision making, whereas with age, you're usually just making a bad decision once in a while. There's also the inability to manage a budget versus missing a monthly payment. Losing track of date or season versus forgetting what day it is. Say it's Saturday and you forget and you remember it later. Then there's also difficulty holding a conversation with a friend or family member versus the typical age-related symptom, which is forgetting a word once in a while. Then people with dementia start misplacing things and they're unable to retrace their steps to find the item versus just losing something from time to time. There are a few different treatment options for people that suffer from dementia. There are medications, which include inhibitors, and they work by slowing down the process that breaks down the key neurotransmitters in the brain. There's also NMDA, and that works by regulating the activity of glutamate. This is an important neurotransmitter in the brain involved in learning and memory. There are also treatment therapies available. Some of the more traditional therapies include occupational therapy, modifying the environment, and also modifying tasks of the person involved. There are also alternative therapies. Those include music therapy, pet therapy, aromatherapy, and massage therapy. These alternative therapies are there to help with mood and anxiety. When people suffer from dementia and they do have memory loss, sometimes they can get angry and very frustrated, and that's what the alternative therapies are there to help with. There are certain risk factors that a person has that cannot be changed in developing dementia. The first one would be age. And also, if a person has a family history with dementia, they are more likely to develop dementia. Or if they have a previous mild cognitive impairment, those all increase the risk factors of developing dementia. There are risk factors that, if controlled, can decrease a person's likelihood of developing dementia. These risk factors that can be controlled include heavy alcohol use, smoking, diabetes, high blood pressure, depression, and sleep apnea. To go ahead and recap, dementia is not a disease, and Alzheimer's is the leading cause of dementia to date. There is no cure, but there are many treatments available for people with dementia. Thank you.